to The World Today on CGTN, live from Beijing. I'm Pan Zheng. We start in the Chinese capital. The Chinese government is holding a press conference on promoting high-quality development of health undertakings and protecting people's health. Now let's cross live to the press conference in Beijing.
Ladies and gentlemen, good morning. Welcome to the press conference on the topic of promoting high-quality development of health costs and protecting people's health, and answer your questions. Joining us today are Mr. Lei Haichao, Vice Minister of the National Health Commission, Mr. Wang Hesheng, Vice Minister of the NHC and Administrator of the National Disease Control and Prevention Administration, Ms. Yu Yanhong, member of the leading party members group of the NHC, and Commissioner of the National Administration of Traditional Chinese Medicine, and Ms. Wang Bin, Inspector of the NHC. Now let's welcome Mr. Lei Haichao. Ladies and gentlemen, good morning. I'm glad to brief you on the development of the health sector. And I also wish to thank you for your long-term interest and support of the health work. First, I would like to thank our friends here for your long-term support and participation to our work. Health is about the well-being of families and the future of the country and the nation. General Secretary Xi Jinping has emphasized that people's health is a key indicator of socialist modernization. Since this year, we have fully implemented this Xi Jinping thought on socialism with Chinese characteristics and the instruction of 20th CPC National Congress, and carried out the themed education. We are also moving ahead with the COVID policy adjustment and a shift of focus in a steady and orderly manner to manage COVID-19 with measures against the Class B infectious diseases on a regular basis. And we have selected 49 regional medical centers projects, started the pilot projects of medical groups in 81 cities, advance the high-quality development of public hospitals in all respects, and accelerate the development of healthcare consortium, and launched a 3-year thematic campaign to improve access to healthcare and enhance patient experience. We have made great efforts to improve the rural healthcare system, with 82.7% of public hospitals above Grade 2 having launched the patient appointment services. And the subsidies of health phase reached 89 yuan. We have continued to improve the accessibility and affordability of healthcare. We will continue to implement the instruction of the 20th CPC National Congress and promote the high quality of the development of health sector. First, we will further advance the Healthy China Initiative and a patriotic health campaign, and to control the main indicators that will affect the health situation of people, and we will promote sound, healthy, and green lifestyles, promote the development of healthy cities and towns, and implement the National Nutrition Program and the Rational Diet Initiative, and promote special activities to prevent and control major chronic diseases such as cardiovascular diseases and cancer. We have strengthened the management of mental illness and management of occupational disease to further control and eliminate the hazards of major diseases. Second, we have focused on the community level to improve medical and health services and continue to deepen the reform of public hospitals oriented to public welfare. We have improved the system of graded diagnosis and treatment, and small cities will have easier access to higher quality medical resources. And we have continued our efforts to build national medical centers and regional medical centers. During the 14th five-year plan period, the state, province, and cities and counties will support the construction of no fewer than 750, 5,000, and 10,000 clinical specialties, respectively. And we will strive for hospitals in cities with large population to reach the level of Grade 3 Class A, and at least 1,000 county hospitals nationwide will reach the level of medical service capacity of Grade 3. And we will focus on promoting 1,000 central township health centers to reach the level of Grade 2 hospital service capacity, to form a pattern of integrated development among city, county, and township levels. We will optimize medical service and quality management, improve the medical emergency response system that combines emergency and rapid response together, and promote the idea that third, we will build a strong public health protection network and effectively provide a strong guarantee for people's health and the smooth operation of the economy and society. We will continue to do well in COVID response and constantly strengthen the prevention and control of major infectious diseases such as AIDS, TB, hepatitis, as well as the prevention and control of endemic diseases. And we will systematically push forward the reform and development of the CDC system, upgraded the capability of monitoring and early warning, emergency response, laboratory testing, epidemiological investigation, and strengthen the synergy and fusion between the treatment and prevention, and build a strong public health system adapted to the needs of the country's public health and security situation. Fourth, we will continue to increase the supply of health services for the elderly and children. And we are optimizing the supporting measures of childbirth policy and implemented projects of inclusive nursery services. We have strengthened daily health management services for nearly 200 million elderly people, especially the disabled and semi-disabled, and promote the construction of national, regional geriatric medical centers and geriatric hospitals. And more than 60% of general hospitals at Grade 2 and above have set up geriatric medical departments. And we have also implemented the Maternal and Child Safety Initiative and the Health Child Initiative Enhancement Program, with the screening rate of newborns for hereditary metabolic diseases exceeding 98%. Fifth, we will continue to promote the development of traditional Chinese medicine, inheritance, and innovation, and provide more convenience for the TCM development. We will implement major projects for the revitalization and the development of TCM, and establish national reform demonstration zone for TCM, and carry out pilot projects for the innovation of TCM, and we will also enhance the integration between TCM and Western medicines and promote the development of talents. 6. We will continue to coordinate all support and guaranteeing work and promote more sustainable and safer development of healthcare. We will adhere to the party's leadership of healthcare and improve the rule of law system in the health sector to improve our governance and strengthen the regulatory and disposal system for biosafety and fire safety to promote synergy between medical education and the capability of innovation and enhance the high-quality training of medical talents and strengthen the training and deployment of talents in the community level to build a team that people can trust. And we will make all our efforts to enhance the Health Silk Road initiative. So much for my brief. So now I would like to answer your questions. Thank you. Thank you, Mr. Lei. Now, please state your agency first before you asking question.
谢谢主持人。北京青年报记者提问：我们都感受到近年来我国医疗卫生的服务能力在不断提升，那公立医院是服务的主要提供者。
In recent years, China's healthcare service capacity has been improving. So, in the future, what is your consideration and plan to promote the high-quality development of public hospitals in next step? Thank you for your questions. The reform and high-quality development of public hospitals are directly related to the experience of the general public in seeking medical treatment and affecting the public's sense of gain. According to the data, from January to September this year, the total number of visits to healthcare facilities in China was 5.11 billion, of which the total number of visits in Q1 was 1.59 billion, Q2 1.75 billion, Q3 1.77 billion, which is an increase. The number in the first 3 quarters increased by 12.4% compared to the same period in 2019, and an increase of 6% year-on-year. And about the number of discharges from our healthcare facilities was 220 million. The number of discharges in the first quarter was 70 million, Q2 80 million, and Q3 70 million. The number in the first 3 quarters increased 16.7% compared to the same period in 2019, and 18.9% year-on-year. And from January to September this year, the bed in hospital utilization rate was 80.2%, an increase of 6.4 percentage points compared to the same period in 2022. The health service center bed occupation rate was 51.4%, an increase of 7.6 percentage points year-on-year. And the bed utilization rate in township health centers was 54.9%, an increase of 4.8 percentage points. So, From the data, we can see no matter compared to last year or compared to the same period in 2019, the demands of people are further released. And our service providing efficiency also is increasing. These are some good situations. And we will take the new development philosophy as our guide to promote reform and high-quality development in a coordinated manner. First, we will fully implement and realize the presidential responsibility system under the leadership of the Party Committee to play the role of Party Committee of Public Hospitals in setting the direction, controlling the overall situation, making decisions, promoting reforms, and ensuring implementation. Second, to further promote the amplification and the deep penetration of high-quality medical resources with a balanced layout, to build a high-quality medical service system with complementary functions and resilience, and accelerate the development of national medical centers and the national, provincial, regional medical centers, promote its penetration of medical resources. Third, we will continue to consolidate the factors of high-quality development in public hospitals, such as talents, technology, disciplines, and management. And we will focus on the specialty construction and accelerate the innovation and application of medical science and technology, and promote in-depth integration of providing medical services and management, and give full play to the role of information technology support. And we will enhance the development of hospital consortium, and we will send expertise, improve the attitude of expertise in treating patients, to help hospitals in community level to improve their capability. Fourth, we will work with relevant departments to deepen the reform and dynamic adjustment of the prices of medical services in public hospitals, optimize the structure of revenues and expenditures, and coordinate the reform initiatives such as the payment method and the personnel and the remuneration system, and strengthen the performance assessment and the comprehensive supervision to let our hospital have a high-quality development to provide better service to our people. Thank you. Next question, please.
谢谢主持人。香港紫金杂志提问：国家中医药综合改革试验区建设是推动中医药传承创新发展的重要举措。请问示范区建设在探索途径、积累经验方面取得了哪些进展与成效？谢谢。
Demonstration zone for the institutional innovation of TMC. And what experience have been gained from this process? And thank you for your interest in the National Comprehensive Reform Demonstration Zone of Traditional Chinese Medicine. Let me be specific. In December 2021, together with NDRC, NHC, and the Ministry of Industry and Information Technology, we have approved a batch of provinces to be the demonstration zone of TCM Comprehensive Reform Zone. Overall, we have seen a very good start with joint effort, multiple breakthroughs, and great advancement. First, our leadership has been strengthened. The Chinese medicine is now more prominent in the overall economic and social development. Each demonstration area has set up a steering group headed by local government leaders. And the situation of the demonstration area has been included in reports of Party Congress. And also it is also the focus of Provincial Committee for Deepening Reforms. And the government's work report will also include the programs of the demonstration zone, clarifying the goal and blueprint. Secondly, the systematic and holistic and synergized nature of the comprehensive reform of TCM has been strengthened through the coordination of consensus-coordinated approach. Demonstration areas have strengthened their coordination at the provincial level and jointly determined reform programs. We also encouraged cities and municipalities to focus on different themes for early and pilot implementations. Third, focusing on key areas and key links, we have taken the lead in realizing breakthroughs in some areas. For example, Shanghai, they have seen community as the very front line of the application of TCM. And in, for example, also Zhejiang has enhanced the management and service level of Chinese medicine. They have built a systematic system of the TCM industry. And other than that, Jiangxi Sichuan TCM industrial clusters has been established, and Hunan announced, for example, in Hunan, the charge for special diseases better treated by TCM, can reduce by 1,000 yuan. Fourth, we will be more active in serving national strategies and helping to realize a high level of coordinated regional development. We will actively serve national strategies such as the Belt and Road Cooperation. We have built 13 cooperation centers of the TCM and 9 other cooperation centers. We also have implemented special plans for the Greater Bay Area development, streamlined approval process of Macau and Hong Kong SAR medicines to be approved in mainland China. For example, there are 5 preparations being approved in Macau that are from Hong Kong. Next, we will focus on strengthening reforms and exploration and constantly promote the improvement of management systems and fully mobilize our capability of reforms and strengthen the coordinated development of TCM and let more people benefit from Chinese traditional medicine. Next question, please.
谢谢。封面新闻记者提问：新发突发传染病的早发现、早报告、早处置非常的重要。请问目前我国传染病监测体系和网络直报系统有了哪些升级？
The early report and early discovery of infectious diseases have been very important. What upgrade has been made to China's infectious diseases supervillain systems and direct reporting systems? What have we achieved and what measures will be taken next? Thank you for your question. Monitoring, early warning, and emergency response are key to the prevention and control of infectious diseases. We have working relentlessly on an intelligent, multi-point triggered monitoring and early warning system to improve our ability to prevent and control and respond to major epidemics. In areas of monitoring and early warnings, efforts have been made mainly to improve quality, expand coverage, and increase effectiveness. First, we have improved the quality of information reporting. We have optimized and improved the direct reporting system for infectious diseases, adjusted the relevant early warning indicators, and we have found abnormal signals in a timely manner. We have issued a list of responsibilities for the prevention and control of infectious diseases. We also built a pilot system for CDC supervisors to further strengthen responsibility for reporting information on infectious diseases. And we gradually realized the automatic exchange of data between medical institutions above the second level and the CDC information system, turning passive monitoring into active monitoring. Secondly, monitoring channels have been expanded. We have established and improved the monitoring system for fever clinics, hospitals, viral mutations, and urban sewage, and explored the development of a pilot, a multi-pathogen monitoring system for acute respiratory infections, and formed a multi-channel monitoring system that take into account regular and emergency situation, inbound and local, urban and rural, and whole demographic and key population. Third, we have strengthened sectoral coordination. We have promoted cross-sector surveillance data and information sharing, regularly conduct multi-sectoral joint consultation, and jointly carried out research and evaluation of risk of infectious diseases. In areas of emergency response, efforts have been made to build mechanism, team building, and enhance capacity. In response to new outbreaks of infectious diseases and key infectious diseases, we have continued to improve the system of emergency response plans, strengthened drills, and continuously improve our capacity for emergency response and epidemiological investigation. We also try to accelerate the construction of national-level emergency response team for infectious diseases. 20 national teams have been established. This year, the central financial authorities have increased investment to the establishment of 5 new national teams for prevention control. And grassroots emergency response team for infectious diseases have been constructed in all cities and counties throughout the country. We will further strengthen department coordination, medical and defense synergy, and multi-channel interoperability, and improve monitoring mechanisms, and form a multi-point triggered, rapid response, efficient infectious diseases monitoring and early warning system, and continuously enhance the national capacity for emergency response to infectious diseases. Next question, please.
谢谢主持人。海报新闻记者提问：党的20大报告指出，坚持预防为主，加大重大慢性病健康管理。
The report of the 20th CPC National Congress points out that prevention should be the mainstay of healthcare, and the health management of major chronic diseases should be strengthened. And what are the priorities in improving the ability of a primary level organization to prevent and treat diseases and manage health? Thank you for your question. Our work in the new era focuses on the demands of community level, and it bears on the most basic public service. And we have improved the system of providing health care system to the primary level. First, through the quality service in community level campaign and the construction of community hospitals, we have strengthened capacity building. Currently, more than 7,100 primary healthcare institutions nationwide have been met the recommended standards, and more than 3,800 community hospitals have been built. And second, we'll have focused on the rural areas and the communities. And in response to the needs of the public, we have strengthened the introduction of talents in general practice and nursing, and we have organized the support for community-level hospitals from retired physicians to help primary level, and and promoted the policy of county-controlled and township employed and township recruited and village employed, so as to enhance the attractiveness of grassroots level hospitals to enable more outstanding medical personnel to stay and be used for at the primary level. And by 2023, more than 5,000 college students, rural doctors will be recruited. And the third, we will focus on the family doctors contracting service for elderly and disabled people. For example, we have expanded from contracted services. We have expanded the contracted services from general practitioners to specialists and from public to private institutions, and guiding multiple forces to participate in contracted services using primary medical and healthcare institutions. And at the end of June, the contracted coverage rate for key populations had exceeded 70%. Fourth, and the level of equalization of basic public health services has been continuously raised. The standards for per capita financial subsidies for basic public health services has been steadily rising, reaching 89 yuan in 2023. And we continue to optimize and improve our service. And according to data, in the H1 of this year, we have provided 89.88 million elderly people aged 65 and above, and 110 million hypertensive patients. We have provided public services for them, and representing an increase of 40%, 3.3% and 69% over the same period in 2022. Thank you.
谢谢中新社记者提问。大家对重大传染病的问题也很关心，想请问目前影响我国居民健康的重大传染病具体有哪些？我国在遏制重大传染病方面又取得了哪些成效？谢谢。
And what are the results China has achieved in curbing major infectious diseases? This question will be taken by He Sheng. Thank you for your question. The Party Central Committee and State Council attaches great importance to the prevention and control of major infectious diseases. At this stage, the major infectious diseases affecting the health of our people mainly includes AIDS, TB, viral hepatitis, and parasitic diseases. At the present, the transmission of AIDS through blood transfusion and blood products in China has been basically blocked. Mother-to-child transmission and transmission through drug use have been effectively controlled. The proportion of antiviral treatment coverage has reached more than 90%, and the proportion of successful treatment has reached more than 95%. So the general situation for AIDS is at a very low level. The national TB prevention and treatment system has been gradually strengthened. New diagnostic techniques and tools have been gradually promoted and applied. The national morbidity has steadily declined. The mortality rate has been maintained at a very low level, which is quite similar with the rate of advanced economies. And the rate of successful treatment has been maintained at over 90%. The service model for viral hepatitis prevention and treatment has been continuously innovated. Blood safety and hospital-acquired infection prevention control has been comprehensively strengthened. And the number of new infections has been substantially reduced. The total number of infected people has been decreasing, and the burden on patients have been reduced. For related patients that will receive hospital attention, the curing rate will reach more than 90%. And for some key parasitic diseases, we have been put under control. Across the whole country, all the 452 blood fluke counties have met the standards for transmission interruption, and 3/4 of those counties have eliminated those diseases. China has already eliminated malaria, has been certificated by the WHO, which is a very important milestone in the history of public health in China and global malaria elimination. Next, we are going to adhere to the principle of combining prevention and treatments, and strengthen our mechanism of party and government leadership and department collaboration and social participation. Consolidate the grassroots multi-disease prevention network and continuously improve construction of a prevention control system for major infectious diseases. We will continue to optimize and improve prevention and control strategies, innovate prevention and control techniques, consolidate our results, and reduce the threat posed to the public by major infectious diseases. Thank you very much. Next question, please.
谢谢主持人。南方都市报记者提问：那改善就医感受、提升患者体验是保障人民健康、增进民生福祉最直接、最现实的举措。那请问国家卫健委对此做的哪些部署下一步的规划？
direct measure to safeguard people's health and enhance their well-being. What efforts has the NHC made to improve the experience of patients in this regard? Thank you for your question. The NHC attaches great importance to the people's experience of medical treatment and has continuously implemented the action plan for improving medical services. Especially this year, we have launched a 3-year campaign on the theme of improving medical treatment and enhancing patient experience. This campaign has covered all the hospitals with grade 1, 2, 3, and all the healthcare facilities in rural and urban areas. It is a campaign that covers the whole process of medical treatment. So first, we have focused on the whole process of the medical services to provide more convenience, to make it more comfortable to see a doctor. From the patient's perspective, a total of 20 specific initiatives in 6 areas have been fully implemented, focusing on pre-diagnosis, diagnosis, and post-diagnosis. And this will be done by 2025. According to the statistic, until now, 82.7% of public hospitals about the grade 2 level have carried out appointment services, and the average appointment and treatment rate of grade 3 hospitals has reached 49.1%. Which is a remarkable increase. In the past, when we see a doctor, we go to the hospital directly. We don't have the custom to make appointment. But in recent years, with the active participation of people and the help of media, the appointment rate has increased remarkably, but we still have a long way to go to continue to make progress. And we have streamlined outpatient services such as collecting appointment numbers, paying fees, and printing reports. And we have encouraged the flexible scheduling of outpatient services, shortened in large cities. we have optimized the arrangement of doctors. If you go to the hospital in Beijing, you will see you will also can have made appointment of expert doctors in the afternoon. It can better enhance the experience of the patients, save their times, and enhance the efficiency. And we have also strengthened the continuity of medical services and strengthened the post-diagnosis management and follow-up visits. And second, we have diversified medical needs. More than 5,500 general hospitals above the Grade 2 provide one-stop services, of which the multidisciplinary diagnosis and treatment services model has been extended to more than 2,000 hospitals above Grade 2, and more than 2,700 hospitals above the Grade 2 have opened at least one new type of outpatient clinic for anesthesia, pharmacy, and health management. And third, we have raised the level of accessibility and equalization of the medical services and deliver high-quality service to the masses. We have set up 13 national medical centers in specialized categories and national, regional, and regional medical centers in children's categories, and carried out 125 national regional medical centers and pilot projects of medical groups in 81 cities, and carried out the building of medical consortium in more than 800 counties. And we will carry out such activities in more counties and townships. And we have built more than 2,000 internet hospitals. And fourth, we have strengthened the ability to serve the public throughout the entire process of seeking medical treatment. Since this year, we have formulated and released 10 initiatives for the convenience and benefit of primary medical and healthcare organizations for the period of 2023 to 2025. It includes to promote the penetration of appointment opportunities to the primary level, and we will deploy middle and senior level physicians to in outpatient clinics, in county hospitals and township hospitals, to provide more service to patients and extend the outpatient service hours in urban communities, and to extend from 1 to 3 hours, so as our people can visit doctors after their work. And we have also carried out services of registration of medicines and delivery of medicines, and also in county and township healthcare centers. We also provide the vaccination services on weekends, so that parents can bring their children to get vaccinated on weekends. And fifth, strengthen the ability to serve the public. Hospitals above the Grade 2 have established social workers, medical social workers, and volunteer systems to provide more services. And more hospitals are improving their services through provide meals and improving parking conditions for patients and providing internet and reading services in public areas to improve their experience. And next, we will continue to summarize the typical good experience in different cities and areas to improve the experience for patients and have to let. Thank you.
Next question, please.
好，谢谢。健康报记者提问。妇幼健康呢是全民健康的基石，有助于从源头和基础上来提高国民的健康水平。
fundamental to improve national health condition. May I ask what will be done in the future to strengthen the service system and promote the high-quality development of maternal and child health? This question will be taken by Comrade Yan Hong. Thank you for your interest in maternal and child health. And from 2020, we have taken implementation of maternal and infant health care law and law on the prevention of rights and interests of women and the outline of development of women and children in China as the core of efforts to consolidate and improve our service system. We have carried out a series of action plans in this regard, so that the sense of achievement of women and children has been continuously enhanced and their well-being has been continuously improved. I have a set of data here. In 2022, China's maternal mortality rate is 15.7 per 100,000 births, and infant mortality rate is 4.9 per 1,000. And the mortality rate for children under the age of 5 will be is 6.8 per 1,000, all of which will have fallen to the very lowest level at history, the lowest level of history, and we will among the front runner of middle and high-income countries. We will continue to ensure safety and overcome difficulties and effectively protect the rights and interests of women and children. On the one hand, it has continued to optimize maternal and child health service by focusing on the major health problems of women and child on the demand side. We have focused on such difficulties as child myopia, obesity, birth defects, and so on, implemented a number of practical and effective initiatives to improve the whole life cycle service model and to promote the comprehensive development of women and children. On the other hand, the construction of a strengthened maternal and child health service system is our emphasis, and the maternal and child health service system is being promoted. We have made up for shortcomings and accelerated the realization of the goal of having a standardized government-organized maternal and child healthcare institution at the provincial, municipal, and county level. We have improved the system of rescue the treatment of critically ill mothers and newborns, and strengthened the application of remote medical service platforms, and made high-quality medical resources more accessible at grassroots level, so as to better protect the health of women and children. Next question, please.
谢谢主持人，我是红星新闻记者。我的问题是，2022年出生人口是956万。
Thank you. In 2022, there will be 9.56 million births, and the proportion of the second children will be 38.9%, and the proportion of third or more children will be 15%. In recent years, our people has been concerned about the supporting measures of fertility, a specific arrangement as the NHC have. And thank you for the question. It is indeed a question of concern for our people. The CPC Central Committee attaches great importance to this. In May, the first meeting of the 20th Central Financial and Economic Commission proposed supporting Chinese modernization with high-quality population development. It put emphasis on the need to establish a sound system of fertility support policies. The NHC and NDRC are the leading departments for this work. We have strengthened coordination across departments and our research into the policy of fertility support. And we made efforts to promote solutions to address problems in the implementation of complementary measures for fertility support, carried out in-depth projects for health of mothers and children, strengthened the 5 systems, and strengthened the service for parental and postnatal care. Currently, relevant departments have been encouraged to introduce a series of measures in education, taxation, housing, and so on. And we also noticed that there are some localities have actively explored these measures, with some introducing policies such as subsidies for childcare, housing, childcare facilities, and even social security for employees. So it is a task well in the progress. So next step, we will coordinate with relevant departments to integrate high-quality population development with high-quality life for people, continue to carry out childcare institution building, selecting national demonstration cities for childcare services, selecting model employers, and work to include related courses in education institution at all levels, so as to promote the childcare service in health institutions and progressively improve policies and regulations and standard and norm so as to optimize our policy in this regard. Thank you very much. Next question, please.
谢谢主持人，我是凤凰卫视记者。我们了解到中医药的根在基层，在群众中。
We have noticed that the root of Chinese medicine are with the people. What are the new initiatives have been taken to expand the coverage of Chinese medicine service at grassroots level? This question will be taken by Comrade Yan Hong. Thank you for your question. The State Administration of TCM has implemented has seen this as the core of our task. Our goal is to let our people have quality medical service at their doorstep. We have established or improved the network of grassroots Chinese medicines. First, we have exerted our effort to improve the network of Chinese medicine service at grassroots level. We have promoted the Chinese medicine clinic in the grassroots level, and on the basis of setting Chinese medicine clinics in accordance with standards in community level hospitals. And the coverage of TCM clinics has reached 87.7%. And over 90% of the township or county level hospitals can provide TCM services. Secondly, strengthen the construction of grassroots Chinese medicine personnel with a focus on the general practitioners. And continue to enrich grassroots Chinese medicine talents both by adopting measures such as standardized trainings, order-based training, targeted recruitment, rehiring, and introduction of brain channels for Chinese medicine talent. At present, professional practitioner of TCM has reached 200,000 and accounting for approximately 90% of the doctors across the country.
“14期间，计划支持所有县级中医院建设2个中医特色优势专科。”
And we have encouraged the county level and township level hospitals to introduce centers and promotion platforms for TCM. We have completed the 2 specialty and 1 center and county level medicine hospital plans. we have constructed a big data and cloud system for the information related to TCM technologies. Next, we are going to work with other departments to continue promote the project for upgrading the capacity of primary Chinese medicine services to make up for the shortcomings and consolidate the foundations, standardize the service at a grassroots level, and made the quality service of TCM more accessible to our people.
谢谢主持人。中国青年报记者提问：
Thank you,
接
China
种疫
Youth.
苗是预防传染病最经济、最有效的手段。
Vaccination is the most economic and effective means of preventing infectious diseases. What is the progress of vaccination in China, and what are the follow-ups in the future? This question will be taken by He Sheng. Thank you for your question. Vaccination is a very important task in China's disease prevention and control. It has achieved remarkable results and has a wide impact. The vaccination rate of school-age children in China has remained above 90%. And the incidence of many vaccine-preventable infectious diseases had dropped to the lowest level in history. We have implemented to its entirety the vaccination management law, continue to improve related policies, strengthen the building of preventive systems, and ensure the scientific, standardized, and orderly development of vaccination. The number of vaccination provided for free by the government has increased to 14, which could prevent 15 diseases. The central finance makes an annual special investment of more than 3 billion yuan. More provinces are expanding the types of vaccines available under the vaccination program. In addition, in some places, some influenza and other vaccines have been provided for the elderly and the young. A monitoring and management system for vaccination have been established at the national, provincial, and municipal and county level, as well as a network of vaccination services at county, township, and village levels. Links between national and provincial vaccination information platforms has been established, as well as between the vaccination information system at each province and national collaborative platforms for vaccine tracing, which improve the quality and efficiency of vaccination. We'll continue to strengthen and the standard management of vaccination, make good use of information technology to gradually promote cross-regional data sharing, and carried out projects for electronic vaccination certificates, so to promote our principles of letting data runs more, let our people runs less, and to improve the accessibility and convenience of vaccine services. Any more questions? China Daily. What are the specific initiatives that will be introduced during the 14th five-year plan period to enhance the institutionalization of national essential medicine, improve related policy, and build stable, high-quality medicine supply? This question will be answered by Comment Wang Bing. During this period, we will focus on improving related policy system, promote the high-quality development of medicine supply. We will encourage drug research and development and innovation, production and supply, and rational use of medicine. It means that we have achieved synergized policies in the above-mentioned domains. First, institutionalization of national essential medicine has been comprehensively upgraded. Yes, we have revised and improved the catalog management methods, optimized the selection and adjustment procedure, and dynamically adjusted the national catalog of essential medicine. It means that the above-mentioned catalog and list are adjusted dynamically according to specific situation. Second, the mechanism for stabilizing the supply of needed medicine will be improved. Focusing on this problem, we have strengthened the national and provincial joint mechanism, strengthened the coordination monitoring of shortage of medicines, respond to different situations with different methods, and deepen coordination across departments. Third, improving the mechanism for the supply of children's medicine and generic drugs, highlighting the clinical values and clinical demand orientation of drugs, has updated the list of children's drug encouraged for R&D, and we already have 5 lists. We have updates to the list. That means that the drugs on the list will have accelerated process of approval. And other than that, we have established a catalog of encouraged generic drugs. So by having this catalog and list, we will prioritize their review and approval and prioritize inclusion in the catalog of medical insurance policies. Apart from that, the capacity of pharmacy services will be continuously upgraded. We have strengthened the monitoring of drug use at national and provincial level, improved the mechanism of comprehensive clinical evaluation of drugs, and application of technical specifications, so as to strengthen the application and monitoring system results.
谢谢新华社记者提问。
Thank you. The Patriotic Health Campaign for a New Era and the Healthy China Initiative are both important ways for advocating a sound and healthy lifestyle and building a healthy China. So how the government will coordinate the implementation of these 2 efforts? Thank you for your questions. I will answer this question. The Patriotic Health Campaign is the party's great initiative and a successful practice of applying the math line to health and disease prevention, and it has played an important role in improving the urban and rural living environment, enhancing the health literacy of the masses, and improving the health of the people. We will continue to give full play to the advantages of mobilizing and organizing people, and to promote this campaign has a history of more than 70 years. It plays a very important role in different phases of history. The health campaign and the Healthy China initiative combined together are very important to help us fight against COVID-19. First, we will focus on the comprehensive improvement of environment and sanitation situation to create a new look for urban and rural area. We will concentrate on urban and rural environment, health, cleaning, and focusing on farmers' markets, small restaurants, and other key places, and old neighborhoods, urban villages, urban fringe areas, back streets and alleys, to accelerate the construction of public health facilities. I will give you an example in Yunnan province. During the pandemic, the Yunnan government, in order to let the people have a custom of wash their hands more frequently. So in many places, such as tourism sites, they established a washing pool. Even though in small counties, you can also see this washing pool. These are the practices implemented with the patriotic health campaign. Second, the popularization of sound and healthy lifestyles. To realize the further improvement of health literacy among people, and health science publicity is being carried out to advocate a healthy lifestyle of rational diet, moderate exercise, smoking cessation, and alcohol restriction, and a psychological balance. To let people have a healthier lifestyle, to enhance the skill of keeping health for our people. Third, we are exploring new modes of social health management and accelerate the development of Health China. And we will optimize the evaluation standards and processes of national health towns, improve the long-term dynamic management mechanism, and promote the high-quality development of national health towns. Our standards for the health towns, health counties is not will change according to the reality. And we will further enhance the development of the Public Health Commission in community level and in villages. In recent years, the Commission coverage rate reached over 90% nationwide, and it has developed in a balanced way. And we will build healthy families, healthy schools, and from families to schools to communities, to counties, cities, province, we will realize a whole chain and whole process development of healthy China, and to promote the integration of our health policies into our policies. And fourth, we will innovate ways and means of our work to let more people participate in this initiative. We should provide legal guarantee, social mobilization, policy, research, and technical support, and other aspects to further enhance the scientific nature of the campaign and to form a better landscape in the societies. Thank you. Thank you so much for today's press conference. Goodbye.
There was a press conference held by China's State Council Information Office on the high-quality development of China's health sector. Now, for more insight, let's cross live to Hu Naijun, Associate Professor from the University of Chinese Academy of Sciences. Well, Professor, let's start with this specific figure, if we are talking about the current status of the health sector in China. Officials have reiterated that per capita public health subsidy in China has reached 89 yuan. That's a little bit over $12 per person. Make sense of this figure for our global audience.
Oh, well, I think this figure is very important. As we all know that the healthcare reform was started nearly 20 years ago. And that time we can see the per capita subsidy to every people is merely around $1 or $2, but after 20 years we can see it has increased to 10 to 20 doubled. So I think this is to say that our economy has grown during the last 20 years, and the majority of our economy benefits are shared by every people. Not only healthcare, but also education, social security, etc., etc. So I think it is showed that our development achievement can be shared by all the people in China.
Now, looking ahead, talking about future tasks, preventing major infectious diseases is still a great task for China. And officials have said that a great achievement has been made. China has eliminated malaria, and that is recognized by the WHO. But what about some other major infectious diseases? What's the plan you've seen?
Well, according to the press conference, we can see that China is going to build a comprehensive system. Not only the healthcare system, not only the hospital, but also the public health, the immunity, and other kind of services, including the community, including every people in this system. You can see that from last year, we have free immune system to the seniors, to the children of some kind of vaccines. That is, in my opinion, one important step to deal with this kind of public infectious disease, because it is public health issues. It must be delivered by public goods, and must be the responsibility of our government.
Thank you very much, Associate Professor Hu Naijun in Beijing. That's it for this edition of The World Today on CGTN. I'm Pan Deng in Beijing. Stay tuned.